Hey, so we're going to go over contraception. So we're going to look at what some of your options are for contraceptives. So what these are things that help prevent against pregnancy, and some of them can also help prevent against STDs. So the first thing on your sheet is abstinence. So what abstinence is it is a physical choice. So how it works would be physical. So write down physical. This is basically abstaining or not having any sort of sexual intercourse, including oral. It's 100% effective against both STDs and in preventing pregnancy. It does not require a doctor's visit. You basically need to make the choice if you do not want to have sex and you think that is the right option for you. Some of the positive aspects is obviously it 100% prevents against STDs and pregnancy. Some of the negative aspects, you can't engage in any sexual activity. So if that's something you feel you want to do, then abstinence is not for you. So you want to make sure that first row on your sheet is filled out under abstinence. If and when you make the choice to become sexually active, we're going to take a look at what are your choices, how do they work, how effective are they, and do they require a doctor's visit? Now, these ones that are on your sheet, these are not the only forms of birth control that are available. There are many other ones that are available, but these are some of the main ones that you will typically see and could potentially have access to the easiest. So first one is a diaphragm. So how it works is it is a physical barrier method. It is 80% effective against pregnancy, so pretty good, but not great. And then it is 0% effective against STDs. Diaphragms are not helping prevent against STDs at all. They only help prevent pregnancy. It does require a doctor's visit to get a diaphragm. This is something you'd want to talk to your doctor about to see if it's the right thing for you and if it's something you'd want to use. Some of the positives are you can insert it up to 6 hours, so it can be in there for a while. It's reversible. It's also an inexpensive option. Some of the negatives is that it has to be fitted. This is why you have to go to a doctor. You have to clean and store it after use. It can increase the chance of UTIs. So this is for females. Females are the ones that use diaphragms. When they are put up the vaginal canal, they can really increase the chance of UTIs. And if there's any weight gain, they have to be refitted again. So this is what a diaphragm looks like. Again, this is for females only. So it's kind of a cup that gets placed up inside the vaginal canal, and it will basically expand against both of the walls. So it blocks any sperm from entering into the cervix, which if it continues to go up, that's where the eggs are. All right, the next thing we're going to look at is a male condom. So these are the most common things that are used in order to prevent STDs and pregnancy. This is a physical barrier, so it doesn't use any chemicals. This is physically blocking sperm from reaching the egg. It's about 86% effective against pregnancy, so a little bit higher than a diaphragm, but still not 100%. And it is 98% effective against STDs. That is a really, really high number. So, in terms of making sure you don't get an STD, these are the most effective. It does not require doctor's visits. This is something you can go buy in the store. So, any sort of like a CVS, any sort of drugstore is going to have condoms available. Planned Parenthood also has them available, and I believe they're free. Some positives, they prevent STDs. They are inexpensive, they're reversible, and they're very much available to anybody who needs them. The negatives, they can break easily. So depending on how you are having sex or what is going on. They can break, which then basically renders them useless. It can cause a decreased sensation in both males and females. Also, a majority of condoms can be made from latex, which can cause a lot of allergic reactions in people. But overall, this is a great thing to use if you are sexually active. So this is what condoms look like. So this would be placed on a male. Basically, the opening would get placed on the penis and rolled down, and it just covers the penis. There are female condoms. So this is another physical barrier method. They're about 79% effective against pregnancy, so not as effective as a male condom. Against STDs, about 95%. So again, not as good as a male condom, but still better than nothing. It does not require a doctor's visit. And these are pretty much what it's made of. Polyurethane. It has an inner ring that goes around the cervix, and then an outer ring goes around the outside of the vagina. So the positives is that it can be inserted for up to 8 hours. It helps prevent STDs, and it is reversible. It's expensive, and it can actually be noisy, like during the process of sexual intercourse. This can also cause some probably comfort issues in females, and it can decrease the feeling. So this is what a female condom looks like. So one end goes up and basically closes off the cervix. The other goes on the outside of the vagina, and then insertion can go through the female condom. These can also break as well, so this is why they're not 100% effective. Right, next is spermicide with a barrier. So this would provide a physical barrier and a chemical barrier. So the spermicide is a chemical that kills sperm, and then a barrier is obviously protecting from getting to the egg. So it's about 74% effective against pregnancy, so not too bad. It does not protect against STDs at all. It does not require a doctor's visit. This is something you can get over the counter. The positives is that it has a reversible effect. So what I mean by reversible with all the ones I've been talking about is they don't change your body in any way. So you use it, you take it off, and that's it. Negatives is it can increase UTI risks. There can be a lot of allergies involved, and it can be something that's messy. So this is what the foam looks like, and you basically push it up into the vaginal canal. Birth control pills. So this is going to be a chemical. It's a hormone. Because they're hormonal, they basically contain synthetic estrogen and progesterone. So usually the hormones prevent the ovaries from releasing the egg. They also thicken the cervical mucus, which would prevent the egg and sperm from uniting. So rarely do they prevent a fertilized egg from implanting in the uterus, but they can. So this is 95 to 99% effective against pregnancy. The reason it's kind of in a range is because it really depends on how well the woman is at taking those pills. It is 0% effective against STDs. You are not protecting yourself from STDs, only from pregnancy with birth control pills. The positives is that it's effective, and when you stop taking it, it is reversible. So even though it is a hormone, your body should go back to normal. Negatives, no STD protection. It can actually increase the risks of some STDs, and there's an increased chance for blood clots and stroke in women. But overall, it's a very safe option, and it is something that requires a doctor's visit. You have to visit a doctor before you can be put on birth control. So this is what birth control pills look like. It will take you through basically a whole 28-day cycle. And depending on the type of pack you get, you'll get a period each month, or you can take packs where you get periods every 3 months. Next is an IUD. So how this works is it's both a physical and a chemical barrier. Basically what this does is this IUD is inserted into the uterus and it causes irritation. This is 99.94% effective against pregnancy. That is very, very, very high. It does not protect against STDs at all. It does require a doctor's visit because it does require a doctor to insert it into the uterus. So it does require a procedure. The positives is it's very reliable. It can be taken out. And you can leave it in there for 1 to 10 years. So you don't have to take a pill or really think about having to take a pill every day. The negatives are you have to go to the doctor to get it put in. It can give very, very, very bad increased cramps. It can also increase the flow of your period. And it's also expensive. So this is something that is expensive. This is what an IUD looks like. So this little T shape will be inserted up into the uterus. This is how it's placed. And it basically causes the lining of the uterus to become kind of inflamed, and it blocks sperm from being able to reach the egg. A birth control implant. So this is something that is different from an IUD. It is a chemical. It is 99% effective against pregnancy. It is 0% against STDs. It does require a doctor's visit. So like an IUD, it does have to be put in by a doctor. Some of the positives, super effective at preventing pregnancy. When it's put in, it will work for up to 3 years. So it's useful for women who find it really difficult to remember to take birth control pills. Birth control pills require you to take it at the same time every day and be very consistent in order for it to work. A negative is it can have temporary side effects during the first few months. Your periods can become irregular or they can actually stop altogether. And this can actually increase acne. So this is what a birth control implant looks like. It's a very small little rod that gets placed on the inside of the arm. So this is the contraption they would use. They'd basically stick this into your arm and then push the implant in, and it will basically control your hormones with the chemical signals. So this is it for your birth control. If you have any other questions about other options or how to possibly get any of these methods, please put a question in the question box and I'll be sure to answer it for you.